Okay, so our project is on Down syndrome. My name is Neha Prasad.
I'm Yadira Zuniga.
I'm Gaganpreet Kaur here.
I'm Jashandeep Kaur. I'm Supreet Kaur.
So the pathophysiology of Down syndrome is when the failure of chromosome 21 doesn't separate during gametogenesis, resulting in an extra chromosome. This may result in an intellectual disability, short stature, gross motor and language delay, and facial characteristics such as close-set eyes. The inner canthal folds may be slanted as well. And the most common translocation is 1421, where an additional chromosome 21 is attached to chromosome 14. The aging process also seems to be accelerated along with comorbidities such as leukemia, Hirschsprung's disease, celiac, or septal defects. They also have an increased risk for Alzheimer's disease and delayed passage of meconium.
Some symptoms for Down syndrome would be general appearance, such as flat facial profile, flattening of the nose, intellectual disabilities, such as delayed language, both short and long-term temporary effect, cognitive symptoms, which can affect on how they walk, move, speak, learn, and play, and behavior symptoms such as stubbornness, tantrums, difficult playing, attention, obsessive, and compulsive behaviors.
There's no treatment specifically for Down syndrome, but there are several important treatments like therapies and medications, physical therapy, speech language therapy, occupational therapy, emotional and behavior therapy. For medications like amino acid supplements or drugs that affect their brain activity, the use of multivitamins and medications such as pain reliever, prophylactic antibiotics, and topical ointment is very common.
Labs and diagnostic. Chorionic villus sampling in CVS cells are taken from the placenta and used to analyze the fetal chromosome. CVS is typically performed in the first trimester of pregnancy between 10 to 13 weeks of pregnancy. The risk of pregnancy is low, like miscarriage from a CVS is very low. Amniotic centesis. A sample of amniotic fluid surrounding the fetus is withdrawn through a needle inserted into the mother's uterus. This sample is then used to analyze the chromosome of the fetus. This test usually performed in the second trimester. After 15 weeks of pregnancy, this test also carries a low risk of miscarriage.
Nursing interventions. The most common early interventions for babies with Down syndrome are providing adequate nutrition, having a set routine, having a plan. It's important to work with your doctor to create an appropriate birth plan. Once your baby is born, tests will be performed to check heart function, hearing, vision, and overall health. Joining support groups. This might mean joining a local support group at your local church, or it may mean connecting with others whose children also have Down syndrome as well. Whatever you choose, joining a support group can help you provide care for your child while also helping you cope with your day-to-day challenges. Other interventions also include physiotherapy, physical therapy, speech and language therapy, and occupational therapy as well.
Patient teaching, provide adequate nutrition, assess the child's ability to swallow, provide information on the proper way of giving food, and provide good nutrition counseling. Frequent consultations are a must. Encourage parents to have child hearing and vision checked regularly. Support child in doing day-to-day tasks on their own.